One of the most important advances in orthodontic treatment of the last decade has been the development of Invisalign. Invisalign is a series of clear removable aligners that are used to line the teeth. Previously, only conventional fixed appliance could be used, or retainers to achieve the same results that Invisalign can now use. However, Invisalign was not available for teenagers. It was only available for people that had a full complement of teeth, and if they had any baby teeth, Invisalign was not a treatment of choice. However, about a year and a half ago, Invisalign developed a new product called Invisalign Teen. One of the concerns that orthodontists had with Invisalign for teenagers was the fact that cooperation. Since Invisalign is a removable appliance, and if it's not worn 22 hours a day, 7 days a week for 2 weeks at a time for each aligner, the movements may not occur. For that reason, Invisalign developed a new feature in Invisalign Teen that is only available for Invisalign Teen called a compliance indicator. The compliance indicator is a bubble that is placed in the back of one of the aligners, and it has a tint of blue on the bubble. If worn 22 hours a day for 7 days for 2 weeks, that clear tint will actually turn very, very light blue, or it will be clear, giving the parents a way of following through and making sure that the patients are actually complying and the aligners are being worn properly. Another concern that orthodontists and parents had about Invisalign for teenagers is the fact that if lost, there are expensive appliances to replace. However, Invisalign also added a new feature to this system in which 6 of the aligners can be replaced at no extra cost. So again, if a teenager loses their aligners and they're not ready to move to the next one, Invisalign will replace them at no extra cost. Otherwise, they end up being over $100 a piece. So it's a nice safety net for parents. One of the things that I've found out since doing Invisalign Teen for the last year and a half is the fact that 99% of my teenagers have been very, very good cooperators, sometimes even better than the adults. Cases are tracking nicely, and the cases are turning out very nice. One of the major advantages of Invisalign over conventional orthodontic treatment are the hygienic benefits. Otherwise, how much easier it is to keep the teeth clean with Invisalign rather than with orthodontic appliances. With Invisalign, you can brush, floss, and go to your dentist for normal cleanings without any interference of the appliances, because there's nothing in the mouth. So the teeth and the gums are easier to keep clean. Conventional orthodontic appliances can cause gingivitis, or inflammation of the gums. This is normally as a result of plaque being trapped between the appliances, and with the patient's inability to remove it properly, it causes the gums to swell and get inflamed. Fortunately, you don't see this with Invisalign, because there's nothing trapping plaque or making plaque stick to the teeth. With the patient's ability to brush properly and floss properly, the gum health is virtually enhanced. Another big advantage for teenagers is the fact that with Invisalign they can eat whatever they want. With conventional braces, the diet is severely restricted because chewy, hard, or sticky appliances can actually damage the appliances and cause them to break, or may cause the wires to bend and make the teeth move in undesired directions. With Invisalign, since you take them out to eat, you don't have this problem. You can eat whatever you want. You can eat sticky foods, you can eat chewy foods, you can eat chewed gum, as long as the appliances are not in place. One of the main concerns that we had as orthodontists treating teenagers with Invisalign is the fact that if cases presented with mixed dentition, meaning baby teeth that hadn't fallen out yet, we couldn't do it. However, with Invisalign Teen, one of the new features that they have is the fact that as long as certain baby teeth are in place, we can still use the system. The way that it works is that Invisalign creates or provides us with a little well for the teeth to grow in properly while removing the adjacent teeth into place. Also, with the 12-year molars or second molars, previously before Invisalign Teen, we couldn't treat any cases in which the second molars were not in because of the fact that if they over-erupted, then they would actually change the bite. However, Invisalign Teen provides with what's called an eruption tab, which is a little protrusion that goes in the back of the aligner that prevents those teeth from overgrowing or over-erupting and holding them in place. That way we can continue to align the rest of the adjacent teeth, correct the bite without those teeth getting in the way.
This is a sample of Invisalign Teen aligner. This is the compliance indicator that we're talking that has a blue tint on it. Again, if worn for 22 hours a day, for 7 days a week for 2 weeks, this blue tint will actually turn into a very, very, very light blue or clear. Again, this is for parents to monitor that the patients are wearing the aligners properly. As you can see, it's a clear material, so it's very aesthetic. Over here we have these another feature that now it's available in regular Invisalign, but it was only available in Invisalign Teen, which are called power ridges, that help torque or tip the front teeth into the desired position.
So in closing, Invisalign has provided another powerful tool in their office to treat teenagers. It used to be that orthodontics or conventional orthodontics was the only way to treat patients. Nowadays, thanks to Invisalign Teen, things have changed and patients can actually get their teeth straight in a very aesthetic way.